the meeting. And by being present, you are giving your consent to be recorded.
Mark Scranton.
Here.
Jeff Antler.
Here.
Candy Clevenger.
Here.
Carolyn Wagner.
Here.
Jan Hack. Here. Debbie Hill.
Here.
Dr. Britt Jerger.
Yes.
Dr. Minigati. Dr. Cody Parks.
Here.
Dr. Smith. And Marshall Webb.
Here.
United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, need approval of agenda topics. So moved. Second.
Dr. Jerger, was that you second?
Yes.
Thank you. Mark Scranton.
Yes.
Jeff Antler.
Yes.
Candy Clevenger.
Yes.
Carolyn Wagner.
Yes.
Jan Hack.
Yes.
Debbie Hill.
Yes.
Dr. Jerger.
Yes.
Cody Parks.
Yes.
And Marshall Webb.
Yes.
Okay, do we have any public comment? Written or in person?
I do not believe so, no.
Okay.
Mark, can I make one comment? Based on the discussion we had in the past month, I'd like to suggest that we do not have a specific roll call, but we have just a common vote. That's acceptable to everybody.
Well, we can, I think, probably discuss that in our new business, and then we can defer to Mr. Baggett, make sure
Okay.
to do that going forward.
I thought maybe that would speed us up.
Yeah.
I would like to do the county board.
Okay, approval of previous meeting minutes, Board of Health meeting minutes from January 17th, Board of Health Special Meeting Personnel Committee meeting minutes from January 24th, Board of Health Special Meeting minutes from January 30th, Board of Health Closed Special Meeting minutes for January 30th. The motion to approve.
I'll make a motion.
I'll second it.
They haven't seen the closed meeting minutes of January 30th.
Yes, they have.
Have they?
Everybody's got a copy of it.
Oh, okay.
Passed them out.
Okay.
Mark Scranton.
Yes.
Jeff Antler.
Yes.
Candy Clevenger.
Yeah.
Carolyn Wagner.
Yes.
Jan Hack.
Yeah.
Debbie Hill.
Yes.
Dr. Jerger.
Yes.
Cody Parks.
Yes.
And Marshall Webb.
Yes.
Okay, communication, board education. Lindsay, you have anything on that at all?
I do not.
Okay. Presentation, acceptance of financial report. We have Lakia here. For those who don't know, Lakia has taken over as our CFO, and happy to have you in the position.
Thanks, everyone. All right. Okay, so in your package, the report is for ending January 31st. We are 16% into the fiscal year. The fund balance is currently at 7.7 million. Total revenue is at 1.2 million, which is 18.2% of what we budgeted. Our expenditures are currently at 914,000, which is 12.6% of budgeted expenditures. And that concludes the report.
I have a question. Have we gotten the money invested in that money market yet?
Yes, it is.
Does it show our interest on there yet?
Yes, right now we're at $2,100. Interest, yep.
Wonderful.
It didn't get started when it's supposed to. So
That's all right,
That's-
2,100, that's.
that's why it's very, very small at this point.
Well, good girl.
Just for the sake of everybody knowing that. Okay, motion to accept the financial report as presented.
I make that motion.
Second.
Mark Scranton.
Yes.
Jeff Antler.
Yes.
Candy Clevenger.
Yes.
Carolyn Wagner.
Yes.
Jan Hack.
Yes.
Debbie Hill.
Yes.
Dr. Jerger.
Yes.
Cody Parks.
Yes.
And Marshall Webb.
Yes.
Review and approval of department expenditures. Anybody have any questions on those? Motion approved. I'll make that.
I'll second.
Katie Carroll. Who'd you say?
That was me.
Mark Scranton,
Yes.
Jeff Etler,
Yes.
Candy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Jan Hack,
Yes.
Debbie Hill,
Yes.
Dr. Sugar,
Yes.
Cody Parks,
Yes.
and Marcia Bell.
Yes.
Okay, grant applications for review and approval.
There are no
We have-
new ones
okay,
right now,
I didn't
so
see this, that's why I wanted to make sure.
nothing out of the normal.
And department division reports, you have those in your packet, and we have, it looks like all of our directors are here. Let's see, Rachel, Kathy, Aaron, is that,
Teresa's not here, she's on vacation, so I'm here
okay.
as the assistant director, Janelle.
And then we have the presentation from the dental division. English inspector, someone.
Hidden over here.
Really quickly, I will say, Pastor Menegatti just joined,
Yeah, I just heard him join.
Okay,
so you need to know that.
Okay, go ahead.
Good? Okay. Well, good evening, everybody. My name is Kim Saban-Pritchett. I am the dental office manager, 19-year service. I just thought I'd give you another quick update on where we're at. We're kind of hidden behind the scenes here at the health department, which is probably a good thing, but still like to let you know what we do on our division. So I'm just gonna start off by, we have 4 operatives that we run out of. We see pediatric dentistry from Monday, Tuesday, Wednesdays, and Thursdays. Our adult clinics are on Fridays. So our kids, we do pretty much full service. We do your preventative, sealants, cleanings, x-rays, fillings, extractions, stay-still crowns, et cetera, like that. At this time, unfortunately, like the adult services are only on Friday. We only do emergency extractions at the time. We have a big problem in Macon County with the availability for our Medicaid clientele. It's just us and Familia Dental. We do a lot of referring to Springfield because Familia Dental, even for they're short dentists and they can't even be seen. I mean, we're getting calls left and right because they can't get into their place till May, June. And so all of our community with toothaches, kids with problems, they're swelling up, we got very limited resources for them. So we do the best that we can. We're a very small organization. I have 1 receptionist, I have me, 1 other DA who's certified to do corona polishing and sealants, and then 2 new dental assistants. When we put the positions open, we didn't have the means to get what we needed. So these were girls off the street. They wanted to learn dentistry, so that's what we have. So they're doing okay. It takes a long time to teach a DA. My thought was behind it. I was hired off the street 32 years ago, and I enjoyed it. And again, 32 years here, I'm still in dentistry. So another great program we like to have is our 3-month, or when they turn, anytime a child has a tooth in the mouth, they can come in and see us. I like to educate them young. Baby bottle rot, get them to educate, not put them to bed with a sippy cup. So that way, if we educate them, maybe they won't have the problems down the road. We see so much decay in little kids' mouth. A 3-year-old can have every tooth in their mouth full of decay. Also, that runs into another problem of sedation because we can't do, 3-year-olds, they don't like to have shots in their mouth. So where do we send them? Who takes Medicaid? So we only have very limited resources. St. Bernard's in Chicago, over a year wait to get, and if you can even get a hold of them. There's ICU or NIC in Chicago. They are pretty reasonable about getting into, but then again, our clients can't get to Chicago. So we do have, a big problem there. Just when COVID hit, they took away a lot of sedations and then they never brought it back. So we had, yes.
Sorry, what do you mean they took away a lot of sedations? Reimbursement?
No, it's like, it was Dr. Arnold. She used to work with us. She went to Central Counties. And then COVID hit, she would do a lot of nitrous for Medicaid. So she would see a lot of our clients. It was open county, so they were able to at least get some type of sedation.
Anesthesia?
It's laughing gas, kind of.
No, I meant, who was Dr. Arnold?
She's just a regular dentist.
Oh, okay.
Here in
But-
town.
She was with us, but then she went to Springfield for Central
Okay.
Counties. Well, then COVID hit and then they stopped doing that because, they're afraid of the aerosols and all that.
Okay.
But then they just let go of that clinic. So she's no longer there.
Okay, and your current dentist is not comfortable?
It's never been, years and years ago, this was, years back, we had talked about doing nitrous here, but I had heard it was like a liability for our building. I don't know what it is today. Nobody has even discussed that. It could be open for discussion. I'm not sure.
Finding that out.
Yeah, we would all have to go do, some classes to be certified to sit with sedation. Correct. So that could be something we can definitely look into. I thought about it in the back of my head. We have a room in the back of our dental clinic. We call it the Mickey room, but it's an enclosed room, and that would be a great room where we could do that. It really saves some of our clients.
How many children would you say per month are being denied that service because it's not available here?
Daily. It's a month, I'd say could be 30 a month even. There is a lot. It is a lot. Even today, it's daily, 3 to 4 patients a day, because we see a lot of the little ones. And today it's, worst case scenario, when we did hospital cases, we took every tooth out in a 4-year-old's mouth.
Oh, wow.
It's.
Because you guys used to go to the hospital.
Yes, ma'am, yes. That was Dr. Yasunaga.
Okay.
And you can maybe help me here is, do you have to do a hospital residency to be able to go to the hospital? Because I thought that's what she told me.
You just have to have a certain, you gotta go through the application at the hospital.
Okay, so you don't have to do like a rotation, okay, so,
Credential.
yeah, you have to get credentialed. We did that, we all did, I did it for years, I did it with Dr. Webb too. We went for years, it was a great program, I ran the program. And we were even like a 6-month, 8-month list, but at least our clients were here. They didn't have to travel, and that's a big thing for our clients to have to go to Chicago or anywhere, it's just so hard.
So is this something that you would like the board to discuss and maybe entertain?
You can entertain it, I just don't, I can't answer for Dr. Kim by no means, but I did talk to him about it previously when he kind of first came on, if he'd ever be interested in it. He didn't appear to be interested in it, but it can always be open for discussion, I'm sure.
Dr. Jurger, is there any downsides from a liability standpoint or anything for the health department?
I'm aware of. We have it in our building too. I would assume we've got all the coverage here on everything else we would do as well. And the simple thing is you don't have to have pipes. You can actually have a cart that you just move to. So you can get that locally. That's not a problem whatsoever. So.
Dr. Webb had tried to do that, a little bit of that, but it wasn't successful because I don't think we had the right equipment at that time.
And that's an issue, but that's equipment is readily available now. And the training is not hard for that to happen. You're not talking about to where the kids are gonna be asleep or anything like that. The nitrous is just, they're still awake, they're still alert, they're still involved, you can still talk to them, engage them. So in other words, it's not that much. Now, Dr. Kim's still not gonna do all of them, because they're still, but he would still be able to do more than what they are doing at this point. So, but the big one would be is if we can get the hospital thing going again. That would be, that's really where it has to come down.
It really is, and it was great, it was wonderful.
Yeah, yeah.
It's just so much easier, when they're asleep, we can just, get in there and get out,
Yeah, I trained both Dr. Webb and Dr. Hannah to do both of those, to do it and so forth, so I'd love to, I'd have to be more than willing to do that again, so.
That was what I was gonna ask you, to help facilitate.
Oh, yeah, yes, I did, both of them,
Yeah.
exactly.
And me and Sarah are still credentialed through St. Mary's, I still have my St. Mary's badge. So it's, we have all the instruments, we actually brought them back, but we have all the instruments that can go back to the hospital, so there wouldn't be a fee in anything for that matter.
Is there a barrier for reimbursement? Would St. Mary's be willing to do this?
That's obviously one of the issues.
Yeah.
Yeah, they gave us, we went through like 2 a week, and then with Medicaid, then they dropped us to 2 a month. So, because we're Medicaid, they lose money off of us, but they at least gave us slots, so that's why our wait list went a lot bigger.
Yeah, they moved me down to 2 cases a month too.
Oh,
That's all I
really?
get now too, so it's the same way, so.
Well,
There's only so many you can do.
if you can think of how we can help, you know,
We need a contact that's fairly high at St. Mary's is what we need.
Isn't that, don't they come and go there?
Yes, they do.
That's what I thought.
That's what,
Do
that's
you
the
need to
problem.
go as high as Teresa Rutherford?
Every bit. Yep. So if someone knows them personally and so forth, then that's that's an avenue that we need to do just to get it, even if it's just one day a month, they can get in and do 3 cases, 4 cases or something like that would be huge.
Yeah, and we can kind of, look at who needs it the most type thing, and, because a lot of people, they just want, oh, it's just an easy fix. Well, it's still surgery,
oh, yeah.
it's,
So I guess we would need to gauge Dr. Kim's
Right.
interest in
Right.
this.
Because
Yeah,
otherwise
that's where
there's
we
no
have to
reason
start
follow
from.
through it.
Do you, Dr. Jurger, would you call him and speak with him and see what he thinks? So we know where we're going,
Sure.
and then we could maybe get somebody to work on the St. Mary's end of it.
yeah, because he would have to definitely be saying, yeah, I want to go versus,
Because he'd need to be credentialed,
yes,
Right.
yes,
so he'd have that whole process to
yes,
do.
yes.
Okay.
So someone just needs to talk to Teresa.
After we see
We'll
if
talk to
Dr.
Dr. Kim
Kim
first.
wants to do it.
If I was to talk to Teresa, would I need to take someone like him or her on the health board? No?
I don't think so. We just
No,
need to see if they would be willing to do some.
they'd be willing to give us some surgical days to get,
And the problem we run in, even at our office, trying to get, because we'll all do some of the cases there as well, even to get the hospital struggles with the states, because they have how many different tiers of medical card now?
We're all capped.
Dear God, it's like 5, 6 of them.
right,
And then they say that you have to be, the hospital to be into every one of them for a child.
Right.
It doesn't happen, and we've had some cases where they couldn't accept that one and charged them the full $26,000. So
Crazy.
it's a massive struggle, even on St. Mary's end, so it's really not St. Mary's just doing it. It's
state.
dealing with the stuff is just, it's really a challenge.
And they don't know how important it is for your teeth and cause you die. I mean, I've seen people with, out here, my grandson just went through this with impacted tooth. And his jaw was clear out here. He had to wait to get it pulled because he had to get the antibiotics there. Yeah, it's crazy. And it was clear in his ear. Next, it would be in his brain,
Oh, definitely.
Yeah, we hear it every day, and it's really sad, and it's like, where do we put these people? We have a certain column that we say just for, I'm swollen, I need to be seen. Okay, here's, a certain time of the day that we keep open just for those reasons, because, it's our job to help, with that situation.
just like a medical.
Yeah,
Dental is the same way.
it is,
They need help.
If you're able to make contact with her and arrange something, I'd suggest get them involved and have her go, because that really should be something she should do.
I think so.
Okay.
Great.
Okay, awesome.
so that's pretty much it.
Am I correct in seeing that you do about 8 cases a day? You have about 8 patients a day in the clinic?
It varies. Dr. Kim has been taking, he has a spreadsheet on how many, because one day we can see 15, and the next day, the no-shows are ridiculous.
Correct me, his day is a 4-day work week?
Yes,
And like,
yeah, he's
So
Monday
you
to
got-
Thursday.
you guys are pretty well maxed out then, it would appear.
Yes, for what we have, like I said,
Number.
I have, my overflow room is, like I said, I was telling you, I brought Peter to fix Paul. So I don't have that back room to be working, but if, if I can get that up and running, we can have an overflow room. We used to go and triple book our schedule, but we have the proper DAs to be able to handle that load. So right now with just me and Sarah, which again, I do all the billing, I do all the office part too, and I only have one receptionist, I try to help her out. But I'm also pulled in to be a DA. So if we have 4 full columns and that whole 4 full columns show up, we we don't have the experienced VAs to handle that overload at this time. You know, they're still in training, it takes a while for them to know, and even to become a certified dental assistant, they have to be like a year and a half or better and know their terminology to even train them to help in that aspect.
Okay, thanks.
Thank you.
Appreciate it.
Thank you so much.
While we're under division reports, I want to slide something in here with a question. Rachel, do you have anything to give us an update on what you were working on with the mental health?
I meet tomorrow with Mary at 4 o'clock.
Okay.
I know that Lindsay and I have spoke on it a little bit, just to say, what resource could we be for the community? How could we help partner? But I don't really have any definitive resolution for that. I can let you know what Mary says to me tomorrow. Maybe some guidance on what your thought is of what we should be doing or what you're looking for us to do.
Well, I know.
Other than a conversation, obviously.
Yeah, I know that one day that Lindsay and I had talked with Brandy before she left. She said there's already a committee that exists. It's made up of people, different people from the community. That's, I think, looking at this already, so it'll be good to learn where things are at with that as well. But for the benefit of the rest of the board, we've been having some kind of a discussion about the news about the announcement of St. Mary's wanting to remove some of their services from the community. And one of the things that they kind of hit me, just because I think it's a significant issue in our community as well as it is in other cities, is, the status of mental health and support services for that. And if we lose that with St. Mary's, if the state allows them to take that off the table, I think our options, around here are pretty limited. Marcia had mentioned to me the other day, just last week, they've hauled people literally out of state to try to find places to take people.
Yeah, the inpatient mental health is the main thing. There's a lot of outpatient mental health services, but there's not, inpatient mental health services are very difficult, especially for adolescents.
Yeah, so I'm hoping to learn some things and we're able to start coming together with a conversation, because I think the state needs to hear from people in the community about how important this is and what's the impact's gonna be. It's gonna put a significant amount of burden that I think is gonna overwhelm the services we already have with Cross Human Heritage and other things that we have available locally. And the other hospital's not gonna absorb this, specific responsibility.
But you have to look at it too, this is a trickle down effect.
Oh, yeah, absolutely.
Because, the paramedic friend of mine that's working at Echo out of Pana. All right, so you've got Echo and Pana and Mowequa. So this is your EMS. They're calling them to transfer them in one shift, 3 ambulances on the road, Indianapolis, Chicago, and Northern Michigan.
And think of how critical, the critical shortage is not just nursing, it's not just dentistry, it's our frontline workers as well, it's our medics, and if they're even taking away that one ambulance to do that transport, that's one less ambulance that's in our community.
3 of them on the road at one time.
Well, and to add to that, we've had, Tammy and I over at Macon County EMA have had talks with a lady from dialysis where there's just not an ambulance service here in town, to where they'll call and say, Jan's ready to go back, and Jan may be sitting at dialysis for 6 to 8 hours waiting to get back to her residence, because the ambulance service here in town just can't
So they're
support
not
it.
running a BLS or just transport service at all?
No, so the new service came in, and it is Medic Basic Partners per ambulance. And they do not have the resources to do a lot of the hospital returns, nursing home returns, dialysis.
So they're running straight
returns.
to ALS then?
ALS. Well, but they don't turn down the BLS calls.
Yeah.
Because there's that basic on there. So, someone falls down.
But still, you're drawing at the resources.
Correct.
For, you got a mass casualty accident, maybe, multiple vehicles or a bus accident or something like that, and you need a lot of ambulances, and now 3 of them are out of town doing transport services.
Well, and DFD quit doing lift assist, so if someone falls and simply needs help up, the fire department in Decatur will not do that anymore.
So I think
So it
they're
takes
starting
an
to
ambulance
partner
on
with
the
Red
street.
Cross volunteers to help with that.
Pardon me?
I think they're starting to partner with Red Cross volunteers to help with those calls too.
So why does the
Because in
fire
the
department,
county, they don't.
so why does the fire department ambulances go to the nursing home at Fairhaven so many times a day? I mean, 10, 15 times a day, or maybe more.
Well, it depends. I mean, I know you could have someone, you know,
I mean, they literally,
respiratory distress,
they literally, I
altered
mean,
mental
literally all day long, you
status.
see them go by our shop, pull in, turn the lights off, and leave. They don't even walk in the building. So, I mean, multiple trips a day, not just a few, multiple trips.
Your nursing homes are high volume
But
calls.
they don't do nothing. I mean,
But
they
they're not
literally pull
going
it, they literally pull in, shut their lights off before they, you know, like they get canceled when they get there and they leave. They don't get out of vehicles.
Well, sometimes they do get canceled though.
They
A
do.
lot. I mean,
A
they're-
lot. Yeah, and there are some nursing homes that, due to workman's compensation, they are not allowed to lift a patient up off the floor. So you call the ambulance, you call the fire department. So,
Well, part of the problem too is, and I'm surprised that the fire department's not doing that, I'm sure the other ones around the county are, but part of the problem you run into, especially when you're going to nursing home type situations, a lot of times they put in a call, you know, for somebody that's, you know, in arrest and get their DOA. Well,
Yeah.
the fire department can't do anything, it's gotta go hire medical authorities, so
has
you
to be
wait for
paramedic.
the paramedics to show up, and then they gotta contact the hospital, and the doctor's gotta say, don't do anything. I can't tell you how many times I've gone calls at 2 o'clock in the morning, you get there, and they got a DNR, but they don't know where the darn paperwork's at. So you end up working somebody that, you know, you're not gonna be able to save. And,
It takes a medic and they have to call
yeah,
medical control.
it's not a perfect
0.
situation. But the resources being strained by taking people out of town, that's
That was my
definitely
point.
disturbing.
Yes.
Okay, well, thanks for that, Rachel, and keep us updated on that, because I think that's what we need to, as an organization, I think that's something that the health department should be at the forefront of, in addressing, how badly we need those services here in Macon County. Okay, employee recognition, I've got a few anniversaries, kind of jumping around here, but I'm trying to follow the list here. Cheryl Bardini, 16 years, Amelia McConnell, 8 years, Amy Scheringer,
Scheringer.
okay, 6 years, Kaylee Durden, 4 years, and Rachel Deerwester, sorry, butchered that up, 2 years. Sorry, Rachel,
It's okay, I'm used to it.
but you're here, that's the important thing.
Thank you.
Thanks. Speaking of employee recognition, so for the benefit of the rest of the board that wasn't able to participate, I will encourage you to participate if you're available down the road. Mr. Entler and I, 2 weeks ago now, I've lost track of my days. 2 weeks ago, we came in on a Friday and we took our little cart and we did a donut run around the health department. And we delivered donuts to all the staff, and we had a really good time doing that. We got to interact with a lot of staff, and they got to find out who a couple of board members are, and it was a really great thing. Doing that to support Good Samaritans, new project, Do Good Donuts. So I thought it'd be a great way to help them out with what they're doing, and the donuts are really, really good. So we will be doing that again in the near future, and we got some other ideas for some other things we're gonna do to come in and support the staff. Occasional lunch that we're gonna plan and that type of thing, because days work, I know that day, I know Marissa, I know there's several people that were out that day for some training and stuff, we were told, so. But we want to do that to interact with the staff. Lindsay thought it was a great idea, so we thought, well, we come in, didn't really get in anybody's way. We was here maybe, 45 minutes, hour at the most. And it was just good to get around and be able to have a little informal conversation with people. I won't mention how much anybody ate, but everybody got a chance, and we did leave some behind, so it was a lot of fun. But anyway, guys are interested in ever getting me donuts for an event or something. That is a really exciting thing they're doing over Good Samaritan with their project. Their goal, long-term, Nikki said, what they want to do is build on that. And eventually they want to open up a storefront, put some people to work, So that's great. I'm a big supporter of Good Samaritans, so.
And deliveries.
And delivery, yeah, they're doing deliveries right now. They're delivering, I think, to the hospitals and some businesses. I mean, they're setting up a route because they're only doing it one day a week. They're building on that. They're doing some stuff for churches on Sundays and stuff. But it's kind of a neat idea, and that organization, they're doing some really great things. So I was glad to help bring some of that to the health department. So, okay, old business, review the personnel manual. I don't think we have anything on that right now because we're gonna make some committee assignments and let new committee members work on going through that. Discussion and action of related position vacancies and related policies.
So there is the position vacancies, I believe it's in, you guys should all have a copy of it, because it shows what the current vacancies are. We've unfortunately just had a couple people, or one other person resign that I think Kathy shared. So we're gonna be posting that position to get that filled. And, you know, in the meantime, with any vacancies, we're just doing the best that we can for coverage, but it's obviously difficult when you're short-staffed. So we're doing our best to get those positions filled, and if you
Where's
guys
that
have.
at, Lindsay? I don't see it.
It was separate
By itself,
copies.
okay, I'm sorry.
Oh, no, you're fine. So yeah, just the highlighted on the back, there's more of the vacant positions, if you guys have any questions about that.
It's something we've been watching. We're getting, as you've given me the exit interview, thank you. We're trying to kind of look at a trend to see what it is that's happening. Most of what we found is just people, like the last person, found another job closer to home, don't want to drive so much, husband got transferred, wife got transferred. It's that type of thing. So we're trying to see what we can do and we're hoping the retention bonus could potentially be a good place to start. We would love to see a nice brochure at some point done and maybe talk about how we're advertising for positions. So that's kind of like down the road, to do something to kind of get some people excited about a career at the health department.
So one thing I'm thinking about, because I saw something the other day, maybe it just kind of popped back in my head again. Has the health department traditionally ever participated in like job fairs that are done around the community at different times as an organization?
We did prior to COVID, yeah.
Okay,
There was like one out in Richland, that we participated in some years ago, and I'm sure there's been some since.
There was one at the KC Hall.
KC Hall, I was gonna say. That's one that Representative Shear has promoted in the past. It's kind of been her little thing that she does. I know that for one KC Hall, but I don't know if there's any coming up anytime soon or not, but.
Sometimes there's one at the Civic Center, the big one, usually once a year.
Have you ever went to Milliken or to Richland toward, the middle of a year to talk to those getting ready to graduate?
So I don't know that and correct me if I'm wrong, are we going in person and doing that? I know sometimes we'll send out job postings to different, like applicable department heads of different, universities around the area, like even Eastern, Milliken, Richland, and just let them know of our posting, like, hey, will you share this with your upcoming graduates? Lakia was actually able to do that with a Milliken professor, which was great, and so we're hoping that that's the positive thing. Does anyone else want to chime in on that?
We do go and speak to Milliken nursing students that are getting ready. Sorry, I can't remember who asked the question. We do go and speak to Milliken nursing students. Rachel and I went and spoke to last month Richland, the Heartland Tech Academy students, even though, they might be pursuing like a BSN or something like that. Still, I don't think it's too early to talk to them about careers in public health. And then you go ahead.
Yeah, no, we try, as best we can to take advantage of all those opportunities, of going to the various places
Do you think that a nice brochure
Are you just,
Do you mean career specific or do you mean like general?
I mean, here's what we do at the health department.
because we
we
have
have
a
that.
very nice brochure, I think.
You
it's
have a
very
nice brochure now?
That says, talks about some of our, well, it talks about each division and then, you know, there's so much that goes on here.
Sure.
But if you were thinking career specific, I don't know how often that would change.
I was just thinking something that, you know, we could say, this is what we do. Look at all the different programs we run, look at all the different job opportunities, the different paths that you could take, you know? And of course, you've got nursing, but you have a lot of non-nursing jobs. You have health educators, you have people that work the peer-to-peer breastfeeding, you have people that work in WIC, you have people that work in lots of different, so I guess looking at what the qualifications are you're after and targeting to that population.
I know for environmental, ISU has a program designated for LEHPs. And every opening I send up
You
to
do?
that professor and he sends it out not only to the
Perfect.
current ones, but ones that have recently graduated
Have
too.
you ever gotten anybody?
Two.
Have you? Okay.
And they normally leave in like 6 to 8 months because of money.
And since Kathy brought that up now, she shared with me earlier, I mean, she's still down one environmental health specialist, but our newly hired EP coordinator has resigned. So now we've got another vacancy to fill for that after we've gone through a lot of struggle to get that designation done. And that's unfortunate. So we're going to be back on the manhunt against another EP person.
And has she shared with you yet? When is her last day and
Friday.
will she be doing an exit interview so that we can see on paper what her rationale?
Believe so. I mean, we haven't gotten that far. She just told me today about 2 o'clock.
I got you. But she's been here 3 weeks, maybe?
It will be 1 month exactly on Friday, her last day.
And she's told you today and she's leaving Friday, so you got less than 2 weeks, obviously. Okay, all right.
What about summer help? Do you take summer help, or would that help you any to go get a college person and grab them from
Student?
Uh-huh.
we have tried to do, bring on more interns to kind of help and train and, you know, maybe retain that they would be interested in working at the health department. I think that the challenge, whether it's an intern or summer help, some of our positions just require so much, and please,
Training.
somebody speaking, but require so much training or credentials to
That
even
have
be
to
in
do
the
it yourself.
position.
Yeah.
And so it's just a lot of time to invest in someone that, you know, might not be here for the long haul, but yeah, we've definitely tried to lean on those things and get creative because it's kind of our only option right now.
I'm gonna throw something out. I mean, I don't wanna muddy the water even more, but I've been thinking about this for quite some time. I really think that we need to entertain the thought of bringing in a specialist that deals with pay grade evaluation for our positions. I think we need to bring in somebody who does that type of work, a financial, who can do an evaluation, look at our pay grades and tell us. Because all of us have heard, it's money, it's money, it's money, but I would really like to see an objective review of it. And I want to hear from them what it is that's out there in the, what it is that's out there as a comparable. I'd like to know where it falls. I would love to see that.
I know many years ago when Carol Carlton was here and she was interim.
Yeah.
We tried to do a salary survey at that point, and I know that it was really difficult to find somebody who, one, would do that locally, and then two, trying to find health departments of like size with like that kind of stuff to be able to try and give you the best
Yeah.
comparison to.
But somebody who's an expert in that, and the place that I would suggest you start, or we start, is the Illinois, what are they called? It's the organization for, community health centers, the Illinois Community Health Association, I think it's called. Anyway, we have done that before at Chick. We had brought someone in. They were not local in Decatur, but they were within Illinois. And their job was to look at those types of things. And they did a rundown and told us where we were. You know, obviously, we wouldn't take someone's pay down, but we would see where we were and where we needed to make adjustments. So that's just my personal thought on this, because I think it would, for once and all, tell us, are we where we need to be, or are we not?
And just a little bit of a historical background to like echo what Kathy said. I do believe that they did hire someone back then, and at the time, we were lower, and that's why there was, and Candy might be able to speak to this, there were like a plan that
Bump
for
up.
X amount of years, they did a
Yeah.
6% raise to get us to a more competitive level.
And was that carried
And
through to fruition all the way?
And then there's since we did have an intern, because, you know, it costs, there's costs associated with doing that, but, so we did bring on an intern to look at that as well, so, and I realize that's not, not exactly what you're mentioning, but just so you have a little bit of a historical perspective.
Illinois Primary Healthcare Association. That's what I was trying to think of.
And then I guess that made me think when you said that, the Illinois Association of Public Health Administrators also did a salary assessment, and that's some of which we have previously shared with most of this board, so just
They may
FYI.
be somebody that we could tap into to find resources.
Yeah, which they did one recently, and that's what we shared with all of you, so that's, yes, I mean.
So I want them to look at our particular, because I don't think it's just the nursing, I think.
No, it wasn't just nursing, it
Yeah.
was across the board, yeah, that they did that.
I mean, that's just mine.
So that being said, we'll segue into the next conversation, which is the discussion of what we talked about last month. And we had some fine tuning to do on that. I'll kind of defer to Mr. Baggett to see if he's got comments on this particular topic. I think we're where we need to be on this.
I was emailed a list of requested modifications to the draft, I think by the personnel committee. I incorporated those changes. They're reflected in the final draft that you have before you.
Okay, so we're looking at the employee retention milestone bonus policy that has been worked on from different people involved in the conversation. And I know last month we had some verbiage that needed to be corrected because it wasn't quite what we thought it was going to be when we saw this. And now those changes have been made, and you're good on what we have at this point, Mike?
I am. I think that I was trying to find my copy of it. I have a copy of it. I don't.
Here, I'll get that one, Mike. It's a separate document.
Thank you. I can pull it up in my email, but it might take.
So, anybody else have any questions or discussions on this?
Well,
Because I know we wanted to take action on it last month, we did because of things that need to change, so. I know Carolyn, you're more in tune on this probably than anybody
It
else.
looked like it was changed to what we had wanted it to be changed to when I read through it. And I do just, and this ties into it, this is what we would have to take to the board, the county board, to talk about how we would fund this, okay? So I do want to make sure that everybody sees that what we would be pulling out of the health fund, what we would propose to pull out of the health fund is 64,375. And the reason why it's such a low amount from what we had first thought it would be was because Brandy and Bethany had found 2 grants that if we don't use them, we're gonna lose them.
And we are allowed to use those grants for this situation. So that's like over, I think it's like about $40,000 that we can offset to do this. So basically what we would be doing would be in 2023, everybody would get something, okay? If it is your milestone year in 2023, you would obviously get your milestone amount. If you had reached a milestone prior, let's say you hit 18 years last year. This year you're at 19. We would give you the milestone of 15 years this year, one time only, to bring everybody up. And then from that point forward, you would get money only on your milestone year. And for those folks in years 1 through 4 who would not have had the opportunity to hit a milestone this year or previous year, they would get a $500 one-time payment. And then they would enter into the milestone event.
Just to
Go ahead.
clear, I'm sorry, you said in years 1 through 4, it would be years 2 through 4.
I beg your
Would get 500,
Thank you.
the first year
Thank
would
you.
just get the
Thank you.
smaller.
The first year are the people at 90 days and 180 days. Right.
125 at 90 days,
Uh-huh,
250
at 180 days. And then no one would get a milestone or a payout if they obviously were on less than good standing as far as their work, their abilities. If they were on disciplinary, yes, they would not receive it. Okay, and you would not double dip, you would not get a catch-up and a milestone. So you would have to take your pick, you know. Your milestone is paid on the first.
Yeah, so what would happen, so if you are having a milestone this year, if you're hitting one of those 5-year marks this year, then you would wait until you hit your milestone, even if that is in November or December. So you won't get money, whereas a lot of people will get money early in the year. You wouldn't get money until you hit your milestone later this year, in which case you would get your milestone bonus. It would be, the way I phrased it is no later than the second paycheck after you hit your milestone. That gives Lakia time to, process it and get it done. It also gives Lindsay time to confirm that the employee is entitled to it and by being in good standing. If you are not in your milestone year though, then once the county board appropriates the money, because they'll be the last entity to act, once the money is appropriated, then it would give Lakia about 4 weeks or so to get everything lined up and paid out on the second paycheck after the county board approves the appropriation.
And I would also say that there was discussion about that this needs to be uninterrupted employment. So there was a question brought up, what about somebody who worked at the health department for 5 years and then had a child and did not come back after their 6 weeks maternity? They chose to stay home for 2 or 3 years with their child and then came back to work for the health department. We cannot count that previous time and roll it into their current. So this is uninterrupted time. So if you worked here from 2000 to 2010, you left for 2 years, you came back 2013, we would have to start this milestone at 2013. I just want to make sure everybody understands that going forward, because there was concern that this would make some people quite unhappy, but we can't just, okay?
The goal of doing this is to help with
It's
retention.
retention, yeah, I mean, and we're not punishing you, of course, stay home with your baby, raise your child, yes, that's important. But from our standpoint, this is all about retention. Okay.
Anybody else on the board have any questions on this?
I have a quick question.
Yeah,
So if someone is not in good standing on their anniversary date when they would receive their bonus, their retention bonus, when they were in good standing again, would they receive it?
No.
So they would, okay. And then my other question is, people who have had an anniversary date this year, prior to right now, so basically once this becomes effective, if your anniversary date was January or February 1st, you would just get your bonus check.
Yeah, you get it whatever it is.
Approval, okay.
Yeah.
Just wanna make sure I understood that.
okay. Anybody else got questions?
I have a question. Is
Yeah.
this only for full-time or part-time employees as well?
Both.
Oh, okay.
And there's no differentiation on the bonus. It's not prorated. It's your years of service here, okay? So if you work part-time for a while, then you went full-time, then you went part-time, you're here, okay, you're here. You came in 2015, you're here, okay?
I have a question about the resolution and the dollar amounts. So if, do we take into consideration the people who will not get theirs until later in the year, and does it fall within the time period we have to use the money on? If they're in those other buckets?
Oh, that's a good question.
So say somebody has a November anniversary date, they're not gonna get their $3,000 till November. And I'm not sure the timing of when this money has to be used up by. So,
That is.
Would you like to use, sorry.
We could
Yeah.
use the grant money for the first few people.
That would be my recommendation. And Bethany, you may be more qualified to speak to this, but if you have money that's going to expire in June, because it's on a state or federal fiscal year, then you would want to use that money for the initial outlay, which is going to be the lion's share of the outlay of these bonuses. So the people who won't be getting them until July 1 or later, that's probably going to be a decent number, but it's going to be accounted for by the appropriation from the county's funds.
I thought that, some of those positions were specifically charged to the grant, and that's why that they could use it for that money.
And I would have to defer to Bethany. I'm assuming you did most of the workup on this in terms of how that was factored in. If that money, if you run into a situation where it is not available when they hit their milestone and they're grant restricted, then it would just have to come out of the health fund at that point.
Yeah, that's what I'm thinking of too.
And for instance, like the starting point, the CCU grant, it is, and same with the COVID, only specific staff members can, it's specific to those staff members. So, but yeah, I think this was projected out to go through the end of the fiscal year. Some of this funding may be on a different fiscal year, so something to take note of that as we move forward. And then we also, we did account for, I forget how many new hires, but we also threw some new hires in there. So there's a little bit of, wiggle room on that. And we have quite a few vacant positions, so.
Okay, anything else?
Yeah.
I'm gonna make a motion to approve this.
I will second it.
Roll call.
You made the motion, right?
Yes.
Mark Scranton,
Yes.
Jeff Bitler,
Yes.
Candy Clevenger.
Yes.
Carolyn Wagner,
Yes.
Jan Hack.
Yes.
Debbie Hill,
Yes.
Dr. Jurger,
Yes.
Cody Parks,
Yes.
Dr. Smith,
Yes.
Marsha Webb.
Yes.
Okay, next item on the agenda is review, discussion, and action needed of flex time pay policy. I know Jeff has done some research on this to get documents that kind of started all this. Back when this was provided, and it's supposed to be a temporary thing. If Jeff, you want to go over that a little bit?
Yeah.
Everybody else.
I've given everybody two documents. One is the flex time recommendation, and the other are the minutes from the meeting on, in the March of 2020 board meeting. The flex time policy accrual recommendation was made as it reads in this document that I've given you. it really simply just says that there's a recommendation that we can actually allow people to accrue more than 35 hours of flex time. And that was done because of COVID and the need to have additional time and be able to use flex time in that manner. I think we're at this point, we're past that. What I wanted to bring to the board is the thought to remove that. I'm looking at the report in our packet. It's most of the way toward the back. It'll probably be tough for everybody to find, but it's very well managed, and I don't see anybody on here that has over 35 hours. Somebody correct me if I'm wrong.
There's just one right at the end.
Is there one?
Yes, the third from the bottom.
Yep, you're right.
But there is just one of the entire list.
But my recommendation is to remove the exception that they may accrue. The second piece of flex time, apparently it's brought quite a bit of anxiety to people in the staff that this is on our agenda every month, and that there's thought that things are gonna get taken away. And my point, and the reason I thought it was on here was as a reminder for us to assess and remove this policy at the appropriate time. So that's what I would recommend. I don't know that there's any written documents that need to be followed up. Mike, am I correct? And that we never did change the policy, so we don't need to reverse the policy.
I mean, I guess I'm not understanding that question, Jeff, because those are two separate questions. That if you never made changes to the policy and you don't want to reverse it, then no, you don't need to reverse it. I mean, I haven't seen the proposal, so are you wanting to make changes to it at this time?
Yes, I would like to strike the wording that says may accrue over 40 hours, over 35 hours of flex time. But from what I understood, please.
I just wanted to make a note of something. With all the vacancies now, we're kind of getting back to that point again, though, where people are working more. I mean, speaking for myself, since I've transitioned to this and now that there's no accountant, I'm over 35 hours a week now. Well, I was lower, but I'm getting to that point now. So if we do take this out, how does that affect with the current staffing us with the vacancies?
I will address that also with the emergency prep coordinator going. I'm gonna be doing environmental and emergency prep again, so my time's gonna be really difficult.
And then one
Right
more
now.
thing.
I'm doing my best to keep it under 35, but just so you know.
Right, but since this transition, I mean, I've been over 35 hours a week. And I mean, I can't not work.
No, what they're saying is not to accrue more than 35 hours.
Right, but I'm saying that now that we have all these vacancies, we might get back to that point again. I mean, I'm still trying to get an admin assistant. Now Susan is getting flex again as well.
So saying that we're gonna be possibly working 40, 42, 45 hours a week instead of 35, so our flex
So
is
you're
gonna.
gonna have a hard time using and
Yeah.
keeping it.
Right.
And I think that there are some positions that will have that,
You're
not
looking-
all positions
You're
by
looking
any
to
means.
balance the chain up there, Jeff, if I'm understanding correctly. Keep it under 35.
Yes.
Yes.
Okay.
But they're still
I'm
concerned
saying
that
that
their balance
we're
will
gonna get back
get.
to that point again. I mean, granted, COVID
Yeah,
has died down,
I
but
totally
the
understand.
need of the health department is back up with all the vacancies. Admin, we don't have to show people at all.
Yeah, so trying to take a day off.
I'm sorry?
If you were about 40 and a quarter, you go the compensatory time out of, Well, that brings it up.
The exempt people.
Wait, you just get the flex card.
Yeah, so, and then keep in mind, trying to take a full day off or time off when you're doing 3 or 4 different jobs becomes even harder, even just trying to take an afternoon off.
For today, I didn't take a look. I was on a webinar.
Mr. President.
Yes, sir.
This is a slight digression from the current discussion, but going back to what Mr. Entler was talking about a moment ago, I'm on the same page with him now. Apparently, the policy that was adopted by the board in, was it March of 2020?
Yeah.
Was never included in the employee personnel manual. That does not make a difference in terms of whether it's enforced or not. The policy that was adopted in March of 2020, even if it's not in the manual as it's currently sitting on people's desks today, the policy is still enforced. The policy will remain enforced until the board takes action to amend or reverse it. So the policy as it was adopted in March of 2020 is still currently enforced until the board says otherwise. So there, if the board wants to amend that policy in any way or take other actions, it would have to. But if the board does nothing, then the policy stays in force as it exists. And if it's not in the personnel manual, that's not relevant. It needs, the personnel manual needs to be updated, but it's not, it doesn't mean that people aren't entitled to it under the current policy.
Mr. Baggins, do you have a copy of the personnel policy with you?
No,
Okay.
I don't keep copies of, I don't know that I've ever been provided with a copy of the health department's personnel manual.
So, just historically, Ed reviewed our personnel manual.
Yeah.
Jeff, I'll make a suggestion because there's obviously some different thoughts here on this, that we would table this for right now and do a little bit more looking at it. And we also need to have the changes come from the personnel committee as far as this, how this gets reflected in the personnel manual, but I think that would be getting ahead of ourselves until we make determine what this is. I can totally appreciate what Peter and some others are saying, looking at the hours accumulated. I don't think it's so much the concern about the hours being accumulated as much as keeping them down to a certain level, but I get what you're saying, you didn't take lunch today, okay? So you didn't take lunch today, you're working all this extra time. You can't take, hours that you're starting to accumulate because your job has changed.
Right.
So you're putting a lot of extra time in. So I think we need to be supportive and sympathetic to that. And so I would recommend right now that we sit on this for another month at least.
And I would suggest everybody, the board members, read this closely because it's got quite a bit of verbiage in it about what the administrator approves and how it's handled. So we'll get back to it.
And I would just like to say, Jeff, thank you for putting that one statement that you did to let the staff know that removing flex is not necessarily not why it keeps being put on the agenda.
Exactly.
I think that'll help, will ease a lot of concerns with staff, so thank you for saying that.
You're welcome.
Well, unfortunately, we've had some other front burner issues that have kind of pushed, prioritized stuff in our list on our board meetings too. Sorry, Karen, go ahead.
Thank you. I would say the same, that flex accrual is happening based on staffing changes, obviously, even in my own situation. And when you're looking at flex accrual balances, supervisors, I know we're all told there's 3 columns for our time clock process. And if the third column shows that they have pending days off to spend down their balance, then even that third to the last employee is not over 44 hours, is not over 35. Like I would covet more instruction, I guess, on making sure that I'm compliant and keeping staff where they need to be. But I have been told in the past by administration that's no longer present, a CFO that's no longer present, that when dealing with EWS, the third column that shows what is projected to be future time off is factoring in that, okay, you may have accrued that amount, but you're using it in the very recent future,
Right.
the near future, I guess is how I should say it.
Well, with the responsibility of our interim administrator to monitor that.
Yeah, so we'll keep doing the flex report. I mean, we'll give you guys an updated copy next month. And the way our system works is like, there are 3 columns. So the first column is like what you have in flex. The second column is the amount that you're projecting to use in flex. And then the third column is the amount taking into consideration time that you may have not used yet. So like if you've got 40 hours in the first column and 5 in the second, it doesn't necessarily mean that 35 is where you're currently at, but it may be where you're gonna be at in a week, because maybe you're taking off Friday. So just to kind of explain, you know, what that chart is, you know, conveying to you guys. And we do try to tell everyone to stay under 35 hours, and when people are exceeding 35 hours, we request that they use those flex hours within 2 weeks. I mean, give or take, sometimes it's not always possible, just depending on what the person's position is, but we push for them to use it as soon as possible, just so that it doesn't continue to grow.
If I'm recalling the handbook, personnel handbook, if you leave your employment, you lose your flex time. It's not paid out.
That's paid out. So you earn-
They're
you
paid out.
accrued that was what you earned, so that has to be paid out to you.
We need to check the handbook because.
Well, time
the
of vacation time is
something
paid
about
out,
that.
personal time is not.
This says routinely employees will not receive pay for accumulated flex time accrued during their employment period.
Correct.
This is, however, if extenuating circumstances arise, the administrator may approve.
I think that, isn't that
It's-
talking about
it's
payouts
talking
while
about
we're still
payout.
here?
No.
Yeah, it's talking about
It doesn't-
payout.
It doesn't differentiate that. If you're-
Differentiate.
Okay, well, let's go.
I mean, I don't know if practice makes policy, but I mean, practice has been that it's been paid, so, just FYI.
Practices that they've been paying it.
There was a case.
We were told that
Many,
was
many
due to a
years ago.
lawsuit
Yeah.
many years ago that was sizable.
Because
And-
we were, because he legally worked those hours, so legally we had to pay him according to that lawsuit.
But that's not the same as compensatory time, is it?
I think
No.
he just got paid straight time, so if you were $10 an hour and you had 100 hours, you got 100 hours at $10 an hour.
Because he was a, I think it was a
Maintenance, Gina.
Maintenance.
But he wasn't, it's the non-exempt versus
Yes.
exempt policy that was in play. And what I've been instructed as a supervisor in the past was that if your employee is terminating and they've given you notice and they had flex on the books, I should try to get that employee to take those days off so that there isn't some gigantic payout on their last paycheck that's
Right.
owed to them in flex.
Right.
But they're still paid for it, is the way it's historically been handled.
Even if they don't take the time off.
The problem is we're so low in positions, you can hardly give people time off.
Yeah, I
That's
mean,
what I'm
I
saying.
can't, you just can't take your time.
I mean, that's where I'm, I guess, at, that do I need to take the next 2 days off? So-
Yeah. And that person in WIC that's higher is because there's only 2 people for a 5-person program.
I was going verbatim.
Okay, so we'll come back and revisit this.
I agree.
Do some research.
There are a lot of open questions, open-ended questions with respect to policy, and, you know, potential revisions of it. I think it is absolutely a good idea to charge the committees with reviewing that more closely, you know, and I guess with more of a laser focus than what you can do in a full board meeting like this. I would encourage the committee to consider inviting employees to that committee hearing to get their input, so that everyone's on the same page when ultimately any decisions are reached.
Okay, thanks for that advice. Okay, discussion.
Just in closing, I would like to compliment the directors in managing this well, and I'm gonna say the past year, I've kept track of it, so thank you.
Thank you.
Okay, discussion Action if needed regarding Board of Health email addresses on the website. Any issues or, I mean, I think everything was probably ironed out, but now mine's working properly. It is slow to refresh. I haven't granted that. I got an email from Susan the time I got it. It was several hours old.
So was it already decided that your guys' email addresses would be on
We
the
were
website?
waiting for the people who were having issues to make sure their emails were both working.
Yeah,
And so it's,
as far as
So we
putting
can
them
get them on the website.
Yeah, that's, the question is if the board would like those on the website or not.
yeah, if
And
you
I
guys
think
are all
so.
comfortable to have them up there, then we can, post them on our website. Of course,
Now, I might have one exception. Dr. Menegatti, are you online? That's not the, I don't know that his is working.
I'm online.
Okay.
Can you hear me?
yes.
Dr. Menegatti,
Yes.
do you need help with establishing and using your health
I'm
department?
okay. I'm fine. I'm listening to you all talking. I
Okay.
didn't want to interrupt you.
In our discussion this afternoon, you had mentioned that you didn't use your health department email. Do we need to wait to put the names on the website until you're able to use yours?
I'm sorry.
So, Dr. Menengati, the question is, your work or your Board of Health email, are you able to use that?
No, I haven't tried that at all. Always, I used to get my email through my work email at the hospital. So since I quit DMH, I don't have access to that mail.
Can you try to get your Board of Health email address or email set up and working?
I can try that. That's not a problem.
And then if so, are you okay with that email address going on our website?
The board email, Board of Health email.
Yes, your Board of Health email.
Who wants that? Somebody. I guess it's okay, but I don't know if I can say that I would reply right away because I won't be accessing it unless I know that I have work at the Board of Health that I need to be looking into, like meetings but I don't know. I will be using that on a regular basis.
Well, I think for the good of the group, we put it out there.
Do you hear me?
Yes, we heard you.
Thank you.
Yeah.
And Evan helped you with your,
Yeah,
so
mine's working.
take it.
And I'm happy to help them too, if you need help.
Yeah, I suggest Evan contact him.
Yeah.
Evan can help you get it set up.
Thank you.
Thanks, Dr. M.
We're gonna go ahead
Reason
and
of
put it on.
access, I think it's some of us don't look at alternate sites very often. So it makes it difficult. That was my assumption.
Yeah, but I've got it on my phone now, and I'm not talking, I'm getting emails all day long on it. So well,
If Mark can do it, anything.
yeah, exactly.
Mark is the standard.
Once he got it set up, then it was easy, because now stuff just pops up on there. So, I mean, it's quite handy, actually, because I got an email today from Lindsay, Bethany, HR, Susan yesterday, but it took a while to come through, and I don't know why. But it doesn't refresh as fast as it does, but yeah. Okay, new business.
So are we doing this?
Yes.
I don't think we have to take formal vote on it,
But
just
we're
gonna
okay.
approve doing it.
So put them,
Please.
because that would be easy, so.
Yes, yes, Marissa, before you go home tonight, please get that done.
You need her sleep.
She could leave the meeting right now and go do that, and come back.
No, because she's the very last one too.
Okay, new business, discussion and action regarding mask mandates for the staff and the public. So this has been something we've been going back and forth on for quite some time. Things have been changing with policies and everything else. And several of us have discussed this, and we think it's time to give the staff the ability to do as they see fit based on their work environment and what they're doing, if they're going out working the field. I know Marissa brought it up before about people doing home care services, things like that. I think, I speak for myself and probably some of the other board members here, but I think we're at a point now, Dr. Smith has gave some thoughts on this previous meetings as well, but I think we're at a point now where I think it's important to give the staff the ability to make the choice as they see fit, provided it falls within the parameters of the type of work they're doing. I don't expect that somebody would go into the dental department and, you know, be working around somebody that wouldn't be necessarily wearing a mask, because I've been going to the dentist for a lot of years, I won't say how many, but it's pretty common to go into the dentist office and somebody's in close proximity to your face, they're wearing some type of protective gear, whether it's a mask or face shield or whatever. So obviously common sense needs to rule, but I want the staff to know that we want them to be comfortable in doing what they feel is appropriate for them to do based on their job responsibility and also what works for them. It really broke my heart when we came in here about a month ago and you guys were having ALICE training, and I'm looking around at an entire building full of people that are masked up. And I felt kind of bad about it, because it's like, I know you guys are doing what you're being told to do, but at the same time, as Dr. Smith said, most doctors' offices now are not making the requirement to wear a mask. The hospitals and many places are not requiring it. They're not requiring traveling on airplanes or anything else anymore. And the time has come to give the staff the ability to make that choice. Yes, ma'am.
I was gonna say really quickly, there are some of our grants that require masking still, so that's something to take into consideration. Not mine specifically, but Janelle, is yours?
So for starting point, the majority of our funding comes from the Illinois Department on Aging. And they are requiring, when we see clients with that program, we mask. Now, that might end with the public health emergency ending in May, but as it stands right now, if we are meeting with a client with a community care program, we are mandated to wear a mask per our funding.
And I understand, I know there can be some exceptions. I know, like I said, talked before about home visits and things like that. I use the dentist clinic as an example also, but.
Yeah, oh, sorry. I wonder if there is a little bit of, just for clarification, basically masking is only happening in clinical care settings or those situations where it's required for the grant. So just FYI for you if you are unfamiliar, because it kind of seems like that you might be talking about what our guidance previously was and to date. And Lindsay, sorry, I didn't mean to interrupt, but like you can speak to that, but so that's what it is to date.
So it's changed since our personnel committee meeting.
The most recent guidance went out.
I have it right here, 2/1.
February 1st.
Yes. We've been working on it. I think that we actually mentioned it in the personnel committee meeting, that we were working on getting that updated. We're trying to get feedback from the supervisors and to get that update sent out to staff. So just FYI, I mean that.
So the only time is when it's required by the grant. And when was the other?
Like clinical care, like direct patient
Direct
care.
patient
So like if somebody comes in to get their COVID vaccine, we would ask that they.
Getting their COVID vaccine if they're not sick?
Because don't you have to scan temperature before you enter the building?
No.
Oh, you're not doing that any longer?
No.
Okay.
And then if you returned when, like, on days, like while you were positive, if you came back to work, we would ask
Yeah,
if you were.
well, of course, I mean, that's,
So,
you know.
I'm just sharing.
Yeah, I appreciate that.
And for environmental, we only wear masks when we're asked to. So if we go into
Sure.
like a nursing home to do an inspection and the nursing home asks us to put a mask on, we'll put a mask on, or if we have to go into a hospital, because we don't want to get to where they're saying that they have to deny an inspection because we don't have a mask on. So we will do that, but just to go into a regular restaurant or something like that, we don't wear a mask any
So
longer.
those patients at starting point that on the grant, the patients also mask up?
Some of them do. They don't
So
have
spiritual
to. It's just as a representative of the Illinois Department on Aging, they want us to wear masks.
So
Well, that's pretty
So that's if we're
consistent.
going into their homes to set up in-home services, or if we're going to the hospital to do a screening for them to be placed in a skilled nursing facility, it's those type of appointments, we would be wearing a mask while we're around the client.
Okay. And your patients that are coming in for immunizations that
So,
are healthy, are you
for-
making them wear masks?
For our clinical setting, we're pretty lax on the adult clinic. Sorry, I can't see you. I'm like trying. We're pretty lax on the adult clinic. The only time where we get in a situation where we want them to mask is when we're taking care of pediatrics, but a lot of times they're screaming, they're crying, they're moving around. There's not a lot of consistent mask wearing. A little back on our policy. Have you seen the policy update? Have they seen that? Because that would probably be useful for you guys to read. The reason why we didn't do it, I kind of helped them with that. The reason why we didn't do it the day of the ALICE training was because it would have been day one. And so we would have been bombarded with, well, can we sit by each other? Can we go through the food line together? We didn't want to take away from that training and the importance and the value of that training to focus on masking. So we said, okay, let's wait till tomorrow so that we're starting brand new and we're keeping the focus where it needs to be, which that particular day was on that ALICE training. We didn't want to introduce something that we've been doing consistently for a couple of years now that would kind of shock the system to everyone during something so important as that training. So that's kind of why that waited till the day after. But again, clinical settings, we are trying to mask in our immunization clinic. I have 3 nurses. If I could put them in a hazmat suit to protect them from getting sick, I would. But it's not, if someone comes in and they're not able to wear a mask, I mean, we're still serving them. We're still taking care of their needs. We're not saying, you can't come back here because your nose isn't covered. We're not doing that, We're doing it to the best of our ability to keep everyone safe, but it's from a very lax standpoint.
So we are making patients wear masks.
When they come back to get their shot, so they're putting a mask on for maybe 3 to 5 minutes, and then during their wait period, they're not required.
So they're no longer putting a mask on when they enter the building?
No, when they come to register at my front desk, which is past those doors, we say, you're gonna go back to the clinic, here, put this on while you get your shot, we give you your shot, you can take that off, you can go sit back out front for 15 minutes. It's really just that time where my nurse is hovering over them that they're wearing the mask. And I think, again, like I said, I think it's just a transition step. I know last year we saw a huge increase in COVID in March. I don't think that's gonna be the same this year. I think we're kind of tapering to a new place. Right now, we're seeing a new strain that's more contagious, but is more mild in symptoms.
Right. And
So-
we're gonna be living with this.
We are,
We're
yeah.
gonna be living with
Honestly,
this for
I would mask my
decades.
nurses up every flu season just to keep them coming to work and not getting sick. But that's just me looking at that from an administrative standpoint. I don't want you sick, I want you here because I need your body here doing your job,
So with what you guys are telling us now, the changes that have taken place, does the board need to take any formal action to support the staff at this point then or not?
I'll say that when we resume in-person services in WIC, I was under the impression that I need to have them masked. Obviously, children over 2, we weren't gonna require that, but we see kids up to 5. And so we were gonna be masking during that because we're weighing and measuring some of those children, if not all. They're unclothed at times.
You're not masking the kids.
We were going to mask children from the age of 3 up to 5. But if there's no need to do that, great, then the masking would be
I would pray that we don't.
the parent and the staff person during the visit.
And like you said, it's supposed to expire here. The official
Yeah.
thing is expired in May.
May, yeah.
Yeah, May 11th. Yes.
I'm just gonna go out on a limb, unless it's required by grant. Y'all are adults, you know your bodies, you know how easily you do or you don't catch a cold. I will make a motion that masking is optional at this point unless required by their grant status. This has gone on for 3 years.
I'm
It's
not sure
time
that
to
we
let
really
you guys
need
know.
manage to that level. I think we can choose for a department, like I said, it's case by case. If I have an adult come into my STI clinic, I'm not gonna make them put on a mask in that situation. I think it would do us a lot of good to have the ability to assess these situations in real time and do what's appropriate for the patient in that time.
Well, I think
That's my
that's
reaction.
what we want to give you that support. I mean, that's the purpose of.
We're making it optional. I mean, that gives you the flexibility.
Absolutely.
By saying optional.
Yeah, and if somebody.
I think what Marcia's getting at is if there is some things that are stipulated because of the grant, you're gonna have to work around that because
Right.
that's in place. You can't alter that.
Or you have somebody come in that you can look at them and go, they're sick. You have the option to request that they put a mask on and that you put a mask on. Because if you're dealing with somebody that's sick, you should be utilizing your full PPE. You know, you should have your gloves, you should have your mask. So making it optional instead of mandatory at this point.
If I can catch them and they're sick, I'm probably not vaccinating them.
I
I'm
was just
probably
gonna
sitting
say,
out the door to
Yeah.
come back at a later date.
I understand.
Bingo. But, I was also gonna say conversely, if you have someone who is still very nervous about this. by
Right,
all
we wanna make them
means,
comfortable on every
if they
level,
feel
right?
like they wanna continue, by all means.
And people do, they come in the door with their own mask at whatever level, and, you know, we don't question that, but then they come in the door without
And
it,
employees,
and, you know,
if
we're
you have
not,
employees that feel that way too,
yeah.
by all means.
And so if an employee wants to mask and is concerned, and they're bringing forward that they think a parent or a family person should be masked, but that person is opposed to it, how would you advise we deal with that situation if there's no evidence of illness?
I would say we are not gonna force masks on people. No.
Unless you are in the part that it is in your
Right.
grant.
Grant, yes, yes. But it sounds like to me in your grant, the patients don't have to wear the mask, you do.
Correct.
Yeah. So,
Well, they're in an environment where they're not leaving usually, and they're everywhere, coming into their territory. You see, like my mother's stationary, she hadn't been out of the house for 2 months. So if they come to visit her, then she hasn't been anywhere, but they have.
oh, in her home, yeah, I see where you're
Well,
coming.
that's by making it, as I said, I mean, if it's with the grant or,
Yeah.
I mean, it's gotta be common sense.
Well, so
I'm
this
just
is-
not wanting the employees to feel that they have to mask every day.
Yeah.
I mean, 3 years.
This update here says masking for visitors says required clinic settings, vaccination, STI, with in-person visits, et cetera, direct patient-client contact. So this is as of February 1st, that requirement's in place. And for anybody that's recently had COVID and somebody states they've had a fever, ask them to come back. So, I mean, you've got some
That's
provisions in here
absolutely.
for visitors to wear masks that are certain. I guess my biggest concern I've got to protect the staff is if you guys have decided to discontinue temperature checks, that's your first line of defense before they ever get through the front door. So if you get them all the way back into your area and then you decide based on observation or you physically take their temperature and then you decide, well, they got temperature now, they probably shouldn't be in here. I would think that you still want to be doing a temperature check at the front door. That's just me, because I'm thinking if they have a temperature of some type, then somebody needs to be saying, okay, what's going on with you, why you're here today, that type of thing. And depending on what the kind of response you get is, then I would say staff's got to make a determination that, I mean, it says right here, they state they have a fever, ask them to come back once they're fever free for 24 hours. If they've already gotten past the front door, you've already let them through the gate. I mean, I would think that's something that you would want to keep in place. I don't understand discontinuing temperature checks.
I think they're just so inaccurate is part of the problem there, because you're doing an infrared forehead thermometer. So if it's hot outside, your temperature is going to be high. If it's cold outside, your temperature is going to be low. It's just incredibly inaccurate that it almost gives people a false sense of security and not that there's something going on and they don't really know. We have those nice little kiosks that you can kind of stick your face in, which is great because we don't have to do anything. Because when we started temperature checks and keeping a log, we had a ton of contact tracers. I would have a contact tracer come in, stand up front, and that's all they would do is check temps. I don't have that staff anymore. I have an administrative support person that sits in what we call the box up front. So she's behind a box. I don't have anyone that can come out and come around staff-wise to do that. So it's kind of cumbersome for us labor-wise to do that as well. And then also, like I said, it's so inaccurate, it's
And
hard to really get anything, you
And I
know?
appreciate that, but your comment really bothers me because we've been doing this for almost 3 years. If that temperature check is so inaccurate,
Oh, I've been saying this the
why
whole
have we
time.
been doing it for all this time?
I
Number
know.
one, and if we have done it, why haven't we done something to fix it to ensure an
So
accurate reading?
the-
I mean, do the physicians in the room agree with me that an infrared temperature is entirely inaccurate? This isn't just me, right?
So, and the screening,
disagreeing with
the
you.
electronic screening that we have,
Yeah.
if you don't have a mask on, it won't give you a temperature.
It
So-
does, because I walked in.
Yeah.
Oh, I
checked
didn't,
it.
apparently it doesn't give me one, it tells me to put a mask on.
No.
So-
I-
It gives you a
I
temperature.
do not enter.
Oh,
Do not enter.
all right, my bad.
Yeah,
Do not enter.
I got denied.
Okay,
You got
so,
that.
We've done this.
I see that tile going
all along, but I've never caught in the 3 years that from my hospital experience to now, I've never taken someone's temperature and found them having COVID that way
okay,
in any of my clinics. Thanks.
so my question is for the board, do we want to take formal action on this, a formal recommendation to give this administration and staff direction at this point that they are free to do as they choose, or do we feel like because of
Yeah,
this
she's got the motion on the floor.
policy here, it's already in place?
You have a motion on the floor.
This
We've
is
had
still
too
more
much conversation,
restrictive.
so I've
This
lost
is
the
more
word.
restrictive than what she's.
Say it louder. Say it
I
louder.
second that motion.
See, you got a second on the floor.
Okay, so we have a motion and a second to,
Leave that to them.
Optional except for.
So are we
grants
leaving it up
and
to the
fundraising.
commission? We're leaving it up to the administration to set the parameters for the
Oh, I-
staff, or just leave it to staff to do whatever they want to?
Because I thought the motion was
As
mask
long
adoption.
as it's. How did I word that?
You said your motion was to make it optional except for where grants require it to be used.
Correct. Or obvious illness,
Or
obvious illness.
This should be common sense.
I think that's.
Thank you.
I think it's weird that they make that, if the grant requires the person that's working on it to wear the mask, but don't require the person that's getting the help not to wear a mask. I don't know.
There's no science in that.
I know.
I'm sorry.
I think just common sense should be given, that's what required.
okay. Take roll call, Susan.
Mark Scranton,
Yes.
Jeff Bentler,
Yes.
Candy Clevenger, Carolyn Wager, not here, Jan Hack,
Yeah.
Debbie Hilda. Dr. Jurger,
Yes.
Cody Parks.
Yes.
Dr. Smith,
Yes.
Marshall Webb.
Yes.
What about Dr. Menegatti?
I just seen Dr. Menegatti has his hand up, so I don't know if he had something he wanted to add.
Hey, don't you have any guidance from IDPH as to what to do at this point in time regarding masks?
Are you looking at me? So
Yeah.
it's based off the CDC guidance, and they are still, like, what we've done is already more lax than that guidance. I mean, it does.
These CDC guidance is about 4 or 5 months old. We don't have anything new right now.
That's correct. No, that's correct. That's why we went ahead and acted, because they have continued to not update that, and we didn't want to continue to drag that out.
And I don't think they're gonna update it since it's gonna end in May 11th.
Probably not, because there would be a lot of work behind that, so they'll probably just let it ride till then, I'm
I
sure.
agree with you. I think we're already past that.
Yeah.
Okay, update from interim administrator regarding progress.
I'm gonna circle back just for a quick second, just because I will send a staff update tomorrow, since that was voted on. I just want to make sure I'm in total understanding. So it is officially optional for staff to wear masks in any situation unless it is required by the grant.
Correct.
And as far as visitors, is also optional for them, because right now it's required, and I mean, even though I know we've discussed that it's kind of been a little lax, right now, per the last guidance provided, it was required in clinic settings. For direct patient-client contact. So we are also not requiring it for visitors, or was that just a vote?
That was my understanding, they're not really doing it now.
No, it's all optional.
Okay,
All
okay.
optional. Keep it simple.
Sounds good.
Keep it
Well,
simple.
I will send that out first thing tomorrow, or maybe tonight. And then an update from myself.
Yes.
So I obviously came into the position, I believe, on the 31st, so I'm 3 weeks in today. I I did type some things into my board report, just basically kind of what's been accomplished in the last couple weeks. I'm not gonna have to find it. But just 1 second, sorry. I mean, basically, I've done, pretty extensive training with Brandy prior to her departure, and during the time that she was here on many various topics. I mean, getting registered for a multitude of different websites and being in contact with other public health administrators in the area. We've done a couple FOIAs in the past couple weeks. There's been 3 of them, so learning that process and making sure that those are provided to the requested, whoever requested them in a timely way. I attended a public health administrator meeting in Springfield last week, and so that was a great networking event just to get in contact with other administrators in the area. Able to have their email addresses and their contact numbers so that I can ask them questions as I'm going through some of the training process. Access to e-grants, which is just where we're doing grants at for our agency, so learning those processes as well as the onboarding, hiring processes, doing a lot of that. We have hired on a couple new staff lately, and so I've been observing and learning that process as well. Being involved in a variety of different HR disciplinary situations, making sure that those are being followed up on and continued from what was left off from the previous administrators. So that's just trying to ensure that there's continuity that's taking place during this transitional period. And then, of course, I would welcome any questions. I know that I only get to talk to everyone once a month, really, in a formal way. So if there are any questions about anything going on or anything, I would welcome those.
How often is that administrator's conference?
That is, I believe, every other month. And those are held at the Sangamon County Health Department. So, and they're very beneficial. I mean, it's just going over a lot of the grant application and just different policies that other agencies have, which is kind of insightful to hear, to be able to look at our personnel manual and kind of discuss what other agencies are doing. So I intend to continue attending those.
That's good. Anything else?
Do you have any needs of us, the board? Anything that we can help with?
Honestly, I don't think so. I mean, I'm super excited to have a CFO on board. So that.
Segue into the next item.
Yeah. I mean, that's a huge accomplishment, and Lakia is incredibly deserving. So I'm really excited to be working with her. It's not really a need, but just a brag. And, I've been doing some media interviews that just getting into that. I know that's a part of the job and was discussed. So we've done a little bit of that with the Herald and Review and WAMD. So that's happened over the last couple weeks if you've seen or heard it. Have, been able to submit our Delta Dental renewal grant. That was due on the 15th, and we probably submitted that maybe a week prior to that. So that was a big accomplishment, just as, in this interim position, to be able to submit the first grant. And, I'm in touch with Ed and Mike for any pertinent issues that have been going on in the last couple weeks. So that is pretty much my update.
Since Lakia's gotten promoted, have you developed a posting for her position?
Yes, we have, and we posted it. So we have received a couple applications, and we're just starting to get that process going and hopefully to receive some more. So.
Okay, good.
Yeah.
Good to know that.
I would like to compliment you. I was at the county board meeting where you were introduced, you were kind of put on the spot, and I was impressed with, you were eloquent, you handled yourself well, so.
I appreciate that.
Okay, next item, assignment of job responsibilities regarding administrative position vacancies, i.e. shifting of any other tasks to any other county departments, i.e. HR, payroll, etc. So I don't know where you're at with that. We've been in conversations with the departments yet about it. roles, I don't know if you talked to Carol or anybody else, you guys talk about taking on some other things, since we're still gonna be looking at what we're gonna do with the assistant administrator at this point,
Yeah, I think.
HR stuff.
So I'm absorbing a lot of the HR stuff, and Susan does a lot of the HR stuff too, and she'll absorb more of it. We've got Bethany's final day coming up on Thursday. So we're just absorbing that in the meantime, with the goal to hopefully fill a position that would be either, whatever that's going to look like, whether that's a assistant administrator position, or if that was a different position that was created that was focused more on HR activities. So, I know we've had a very brief discussion about that, but we are in the meantime just absorbing those duties in the best way that we can, and, continuing to look for another administrative assistant as well to also assist with those duties.
Okay, one of the things I think I might have mentioned to you was to find out what your thoughts were about putting something together with a plan, contingency plan for staff from an administrative and director level, that if something were to happen to you, hey, I've got a couple sick days here I need to use, I've got a vacation I'm gonna plan. What are you envisioning organizationally about who would take on what responsibilities during your absence if something comes up?
Right now, in this current state, I suppose I would rely heavily on Kathy for FOIA, HR, hiring, onboarding process, I would rely on Susan. Grant applications and things like that, I would hope to always plan in advance and have those items done. Just I know they're very timely and specific on how they have to be completed. Is there anything in specific?
No, I'm just thinking, because you've absorbed a lot in less than 30 days, and I'm just thinking that, I would like to see a plan in place, not only for the benefit of the board, but also for the staff. They know basically who's in charge of driving the bus in your absence. So I think clarifying that, I think that would be really beneficial.
Obviously, all of the leadership team is always kicking in any situation, honestly. They've been very, very helpful, in the past 3 weeks, literally just being able to rely on them to ask questions or, assist in a situation. Rachel and I met for this, the inpatient mental health unit closing. We've, had discussions about that. So, just staying in communication with all of the leadership team and, being able to rely on.
Something, an emergency that took you abruptly out of your position for 30, 60, 90 days.
Yeah.
Okay, what structure, do you have a structure of who's gonna do what and who assumes your duties?
I'll be honest, I don't really just answer that question in a most transparent way. I don't really have a plan for that. Ideally, in a perfect world, it would be the assistant administrator who I would rely on, and then she would rely on me in the same situation if it was reversed. So, in total transparency, I don't really have a plan on how that would take place. I do agree that it's important, just because those things can happen very unexpectedly, and Bethany might have more to contribute to that conversation.
Yeah, sorry, I didn't mean to interrupt. I was just trying to give some historical insight. So there always has been a succession plan. The absence of the administrator, the assistant administrator would step in. In the absence of both of them, it is the director of clinical nursing services. It says that in that job description. So I think that's previously been shared with all of you. And then I would just say, I echo the board and looking out for Lindsay that, as much as you can try to prepare for all the worst case scenarios, or what grant contracts you think might be up or whatever. There's always a quick turnaround on all the things. The state, normally wants it immediately back, or there might be a staff situation, whatever it might be. So I echo that from, having coverage that she can get that work-life balance as well, so.
Okay, anybody got anything else for Lindsay? On that? Okay, thanks. Discussion of staff needs for vacancies, wage comparisons, we already covered that earlier. So, update regarding applications submitted to date. Right now, with the administrative position, we've gotten several applications. Been sending those out to the personnel committee members as they can, because some of these are not coming through in proper format. Some of them we haven't been able to open. We've had a couple of them actually come through the mail for, I don't know why, because the instructions are pretty explicit about how they're supposed to apply, but anyway.
Can I interrupt for a second?
Yes.
Is it my understanding then that the personnel committee is the one conducting the interviews and making the hiring decision?
No, we're going to, at this point, this is for the administrator position, permanent administrator
I
position.
thought you said administrative assistant.
No, I'm sorry.
Okay, I'm sorry.
Yeah, I misspoke there, Mike, sorry. So, I would like to get personnel committee meeting scheduled here very soon. I know I wanted to get this maybe done before the meeting tonight, but I know Candy was not gonna be available. I was gonna have a potential conflict. I know Marcia's schedule, you're not on the personnel, Carolyn's schedule, sorry. The timing of trying to do this early before the meeting was probably not gonna work, so we're gonna try to probably do that hopefully in the next week or so. Try to get a personnel committee meeting scheduled, because we're gonna be near our deadline next week of what we set for applications being accepted. And I think the ones we've seen so far got various degrees of what we're looking for, but we need to sit down and review them as a group and then come up with a short list up to this point of where we're at. And then
Do you have an idea of a date?
I don't right now, but if you have any specific days that absolutely will not work for you,
Mondays and Wednesdays
Let me
right
know.
now won't.
Okay.
Mondays and Wednesdays, but aside from that.
certain days better for you,
Mondays and Fridays.
Are best for
Best for
you.
me.
best for you,
And
okay?
Friday would be best.
Jeff.
for me.
I'm flexible.
So is it Tuesday or Wednesday possible for you, or,
It has to be late,
okay?
like at 5.
So if we did a Friday, does that work for you? And can we do it earlier, or does it need to be like late afternoon, or,
I can be here by 3.
okay, Jeff, what about you? Okay, so let me check my calendar and I'll make sure I let Lindsay know, and we'll put something together, maybe we can do something.
This Friday or
No, it had to be next Friday, we don't have time to put an agenda out,
Friday.
and I know you'll probably be back in town. Yeah, I don't know how my trip goes.
Well, and you probably also want to wait until the application, is this for, the position closes the 28th, correct? So
Right.
I'm just saying, to echo what you're saying, you'd probably want to wait till next Friday anyways. Not this
Yeah.
Friday.
You're looking at the 3rd.
Yeah, well, that's everything I was looking at too, because that's the end of our deadline. So by then we'll have, what we have to review, we'll have that to look at.
That would be great for me because I'm going back to Florida.
You're going where?
Back to Florida.
Okay, is Bill going? He's got to stay in campaign.
Where are you?
So 3 o'clock tentatively for next Friday, works for everybody on the personnel committee at this point?
Yep.
Okay, so I'm gonna put that down tentatively, and then we'll confirm that before the week's out with everybody.
Okay.
Yeah, get an agenda put together, Lindsay, for that, and we'll let you know about that.
Good.
Okay, got that saved. Okay. Discussion and action regarding election of officers per requirement. So it's brought to our attention by Mr. Baggett last month's meeting, I believe, that we were need to make an adjustment on what we had incorporated into our bylaws because it didn't coincide with common sense and timing of things. I still struggle with this because you got 6 months, you can't do anything, and then you put somebody in an officer position and potentially in 6 months their term could be up, but if that's what the requirement is by the state, then that's what we gotta do. So, we need to reelect new officers or in some format, make a decision about officers going forward after tonight's meeting.
May I?
Yes.
Is anybody here that's not already on the officer interested in a position as an officer of this board? All right, I make a motion that we retain the officers that we have currently for the next term.
Through the end of this current fiscal year. That's a proper motion.
Which would be
Do we have,
November 30.
do we have a second on that?
I'd say.
Dr. Smith seconds. Any discussion? Susan, call the roll, please.
Mark Scranton,
Yes.
Jeff Entler,
Yes.
Candy Clevenger. Carolyn Wagner.
Yep.
Jan Hack.
Yep.
Debbie Hill. Oh, should I? Dr. Turger,
Yes.
Cody Parks.
Yes.
Dr. Smith,
Yes.
Marcia Webb.
Yes.
Thank you, everyone, for your support and your elections to step up.
Mark, that is the quickest item you've had on the agenda.
Oh, my, okay.
We're all in support of you.
That means a lot. Okay, so that being said, then the next thing that we will do, and I'm gonna review this, but if anybody is interested in being appointed to a specific committee that is made up of different committees on the board, please drop me a note and let me know. And I will reach out to everybody individually, and we will finalize that next month's meeting.
Can I just ask a quick question, Mark?
Yes, sir.
Because I'm new enough. What are the various committees?
The personnel committee, bylaws,
No,
no,
you have 3 standing committees: finance, personnel, and nominating.
nominating, yeah.
The president has the authority to appoint ad hoc committees to deal with issues as they arise, but those are your 3 standing committees that
Right.
have to be filled.
And the nominations will be important because that puts us in March next month, and we will be able to make nominations for any vacancies that are going to come up for terms that are subject to expire or up for renewal in May. And I think that's one of the reasons Jeff was asking for that information from you. So we need to have that for next month.
I will get that
Because
to
we
you
want the
tomorrow.
nomination committee to review that.
Who's on the nominating committee now?
Dr. Manicotti, Cody, and no, I don't remember. I think it was Jan.
Oh, yeah.
Yeah,
Jan,
yeah. So we'll have to look at that, get that squared away going forward, so we can be prepared when those terms are up for renewal. And I don't know what we have, I think, right now. Jeff, do you know, I think we were gonna have, what, two terms up for renewal? Does anybody know that's on the board? Do you know if your term's up for renewal mid-year?
We have Jeff Entler is up May 31st, 2023, and Jan Hack is up May 31st, 2023.
Okay,
And Dr. Smith's term ends May 31st, 2023, because he just took up the,
fill in vacancy.
yeah.
And if y'all accept to, you
Give me
know,
a second to look at something real quick.
Okay.
Thank you.
Marcia Webb is another one because she took the expiring portion.
Buddy, we're just gonna go down the road.
You are
And me. That's not what my.
2025.
Oh, okay.
okay, so we got 3 potentially up for renewal then at this point, right?
Wow.
Jan Hack, Jeff Entler, Dr. Smith, and Marcia Webb.
Oh, okay, sorry. That seems kind of weird to be a third of the board, is up for renewal at the same time? It's also more staggered than that. Okay.
Got 5 up in 2023.
Given that you have 3-year terms, I think a third of the board every year would be consistent with statutory practice.
Yeah.
I'm trying to determine, there is a provision in the statute which says when the terms begin, and unfortunately it hides from me every time I go looking for it. But I'm not positive it's June 1. I would want to say it might be July 1. In which case the terms wouldn't lapse on May 31st, it may be June 30th.
Well, no, I guess I wasn't meaning that. We have to have nominations submitted to the chairman for selection for them to approve it at that following month's county board meeting to take effect then the following month when the terms expire.
Right.
I was thinking it was a May to June thing, I'm pretty sure, because that's when I came on. Okay, so we will work towards getting that done. Discussion and action regarding Board of Health meeting minutes. I don't think we have anything on that.
Can I ask a question on that, please?
Yeah,
If I'm understanding the Open Meetings Act correctly, and Mr. Baggett, please correct me if I'm wrong. The only closed session is the ones that have to be verbatim, correct?
They don't have to be verbatim, they have to be recorded.
Okay, so,
The Attorney General does not trust you to accurately transcribe the meeting. It wants an audio recording of the meeting so that it can actually hear what was said during a closed
closed
session.
session, but our open session like now, is that required to be verbatim, or can it be like the overall synopsis, like the other boards?
That is absolutely the case. There is nothing in the law that requires a verbatim transcript. It has become kind of a historic practice in Macon County. I think it began with the Macon County Board and its committees because the executive secretary was pretty good at shorthand and was capable of doing verbatim transcripts, essentially verbatim transcripts of county board meetings and committee meetings. I think everybody kind of got used to it, and that practice started to carry over and bleed over into other county boards. But there's nothing in the law that requires a verbatim transcript. All minutes require is an accurate reflection of who is in attendance at the meeting, the items that came before the board for discussion and action, and then the results of the actions taken, if any.
Who put the motion, the first, the second, and
in fact, all you need to record is who moved the motion. You can generally, I had to do this as a bit of research, you're not required to note who seconded the motion. That is common practice, but it's not required. You are required to show who moved the motion, but you do not have to show the second. Normally, you can get away with just saying properly second.
so we just comply with the Paperwork Reduction Act from Susan.
Yes.
Paperwork. Which means turn off less paperwork
So
too.
I put that on the agenda just because, like, for example, in January, there was 3 meetings and I think it totaled out to 117 pages.
yeah.
So honestly, economically, to have somebody paid to review that 117 pages while listening to those transcripts or that meeting
It's a
back,
lot.
it is very time consuming,
Yes.
4, 5, 6 hours. And then when Susan's done with it, she passes it on to me to review it again. So, you know, it just feels like a lot of time that could be better used elsewhere, given especially the staffing shortages, but honestly, even if there wasn't a staffing shortage.
Toner and paper alone.
Yeah.
And honestly, I don't know, I mean, there's definitely benefit to a verbatim transcript, but really, my personal opinion is if I wanted to get the synopsis of a meeting, I would not want to read 117 pages.
Right.
I would just want to read the synopsis of the motions and, you know, if they were approved or not. So that's the reason I added that on there, is that just with the staffing shortage going on, I'd like to use our resources elsewhere if it would be approved by the board to do so.
And I
make a
can try to
motion that we
segue
go
towards
to
that.
I make a motion that we go to a synopsis. Absolutely. What, 7 hours transcribing the closed?
More than that usually.
And to be
Yeah, so a
clear,
lot of time.
to be clear, I hate to interrupt a motion on the floor, but to be clear, back to Marcia's point, with respect to closed sessions, the minutes do not have to be verbatim then either. You can still synopsize what occurred in the closed session. So you don't have to go above and beyond there. You just have to have an audio recording of the closed session. The Attorney General, if there's ever a challenge to it, can then compare the minutes, the synopsis minutes, to the verbatim record and decide whether or not a violation of the OMA occurred.
Okay.
Are you comfortable with that?
I am, yes. I just looked around at other agencies, other health departments in the area and started filtering through their minutes and realizing no one else does this. And so, obviously things are constantly transitioning and I just wanted to bring it forth as an option to use our time and our resources.
The only
in a
thing
better way.
I would maybe request, which we talked about, Lindsay, is this still be recorded,
Oh,
Yes.
so that I can go back and get the
Yes.
synopsis.
Yeah, it has to, yeah.
Yeah, we definitely don't want to change that.
Well, and that's a CYA thing
Yeah.
too.
Right,
so-
yeah, absolutely.
So you made the motion?
I made a motion, it's on the floor.
Second.
Is that Dr. Smith? Mark Scranton,
Yes.
Jeff Antler,
Yes.
Sandy Clevenger,
Yes.
Carolyn Wagner,
Yes.
Jan Hack,
Yes.
Dr. Jurger,
Does it count if I say please? Please.
Coach Park, Dr. Smith,
Yes.
and Marcia West.
Yes.
And also on that note, we were told, because the county board does this also, we don't have to do a roll call every time we have a motion to vote on, correct?
That's correct. There's nothing in the law that requires a roll call for every single vote. You can generally take a voice vote on almost any matter. If there is something that you need to take a roll call on, I'll let you know. I haven't found it yet, not with the Board of Health. There are matters the county board has an obligation to take the ayes and nays on. But, and when I say ayes and nays, I mean doing that. When you call for a voice vote, you still ask for ayes and nays. It's a mess. But generally, you can take a voice vote if there, but Robert's Rules of Order, very clear, if any one member wants to have a roll call vote on any particular item, then that's the end of the ballgame. There's no choice. You have to have a roll call vote if one member wants it. And then that one member could ask for it on every single vote if they want it to be finicky that day.
So do we want to make a motion to go
There's
this?
no need to adopt it. It's not a formal policy of the board.
See if the rest of you pick up on that. Okay, moving right along.
I want a voice, I want a name.
Moving right along, discussion action regarding Macon County Board Resolution approving change appropriations in the FY 2023 Health Fund budget for United Way Dental Clinic expansion payback resolution. And that's on like the next to last page of your packet, if you haven't had a chance to review it. Lindsay, you got anything on this?
So. So many papers, this is gonna be so much easier next time.
It's the very bottom, Lindsay.
Sorry.
Page to the
That's the
left.
very next to last
It's
page.
on the same page as the recognition of people.
So basically, we received money from United Way to put towards a dental expansion that was not used due to limited resources, COVID, amongst other things that you can see in the resolution. And so we are paying that money back to United Way. Because of the timeline of when it was given to us and the amount of time that's passed since. So that's what that is outlining.
Okay, do we have a motion to approve this?
I will.
Second it.
All those in favor?
Aye.
Any opposed? Wow, that looks really well. See how much
And
time it
also,
saved
just to
you?
follow up on that a little further, the person from United Way is very much willing to continue working with the health department if that was ever on the table again to do dental expansion. But so she's open to having that conversation again if we want to go in that direction. But for right now, we're gonna pay the money back, and if that becomes a possibility in the future, then we'll be back in touch.
Well, my mind is thinking, as we've been talking about needing someone to be able to do expanded services for our dental patients with the use of nitrous, so,
Yeah.
I mean, if that's ever a possibility, if we think we could get, you know,
Funding for that.
funding for per diem dental, you know, who would use the nitrous or, you know, whatever.
Okay.
Just a thought, just a thought.
How much money is given back or will be given back?
50,000.
The whole 50.
Yeah.
Okay, thank you. Review and approval of 2022 annual report.
That's me. We, every year, last page, yes. Every year, 90 days after the fiscal year, we're required to complete an annual report. That's a state requirement. So basically, it's done every year. If you've been on the board before and you've seen it, you've voted on it. But basically, anything the health department does that can have a number put to it, we track that. Our individual supervisors track, the doings of their divisions, and then we report that on the annual report. So, if you have any questions or anything.
Does this get published?
Yep, it'll be published on our website. We'll send it out to you all, the finalized copy, media, things like that. And then we also have to send it to the state.
Thank you.
Okay, any questions on that? All right, we have no closed session items to discuss. So that puts us to the last thing.
I think you might need to vote on that, or vote to approve it, maybe,
Oh, vote to approve your report.
the annual report.
Okay.
Sorry, don't need that.
That's fine, glad you mentioned it. Okay,
I make a motion to approve the annual report as presented.
I second it.
okay, all those in favor?
Aye.
Opposed? Motion carries.
All right.
Forcefulness, you guys.
It's exciting.
The rest of the hell of the meeting for another 28 seconds. Okay, motion to adjourn.
I want to hear the same eye enthusiasm.
I'll need your closed session notes.